This is the Zoll AED Pro defibrillator. Daily checks involve making sure the unit is clean and also making sure there is a green tick in the window indicator underneath the power on-off button. If a red cross is indicated in this window, then the unit is not functioning properly and needs to be checked. One of the issues that could cause a red cross indicator in the window would be a depleted battery. To replace a depleted battery, open up the case housing using the clip and pull up the case housing. Take out the old battery and ask for a new battery from portering. Replace the new battery into the unit and the machine will switch itself on. It will do a self-test and ask you to confirm that the unit has a new battery. The machine will then test itself and indicate if it is working.
If new battery, press left soft key. Unit OK.
New pads can be requested from the Resus Central store via portering, and new pads need to be inserted into the unit into the defib pad socket. CPR feedback pads are shown here, and they have a CPR feedback device in the centre of the pads with the cross. There is also a version of these pads without the CPR feedback device. The pads can be placed on the patient's chest in a normal configuration as indicated on the pictures on the pads. If the pads have a CPR feedback device, this needs to be placed under the hands of the rescuer doing CPR. This needs to be done carefully and quickly.
5, 4, 3, 2, 1.
CPR then starts again, and the other pad can be placed as indicated on the picture. If the pads need to be placed in an alternative configuration, or if when the pad with the CPR feedback device is placed on the patient's chest,
5, 4,
it does not
3,
sit under
2,
the rescuer's
1.
hands doing CPR, the CPR feedback device can be detached and the pads can be placed in the correct position as needed on the patient. To use the device should be switched on.
Adult pads. Open airway. Check breathing. Attach defibrillation pads to patient's bare chest.
Attach the pads to the patient, and when the pads are connected,
Don't touch patient. Analyzing. Don't touch patient. Analyzing. Shock advised. Don't touch patient.
once normal
Press
pre-shock
shock
safety
button.
checks have been done, it's now safe to give the shock.
Don't shock delivered. Start CPR.
A metronome beep indicates CPR at the correct speed. CPR of poor depth will be indicated by the unit.
Push harder.
If the rescuer corrects their performance, this is also indicated.
Good compressions. Analyzing.
If the unit is charging up ready to give a shock, but you do not wish to give a shock, perhaps due to a safety concern or the patient showing a sign of life, switch the machine off. This will disarm the machine. The machine will power down and then can be switched back on again immediately to recommence analysis.
Adult pads. Don't touch patient. Analyzing.
A monitoring only 3-lead ECG cable is also available on the resus trolley, which should not be used routinely. It's only for emergency use as it will deplete the long life battery.